What do you think you would be able to do with $147 billion? What if I were to give you that amount of money and that amount would last you, your children, and your grandchildren's lifetime? What if I were to also tell you that each year the amount increases? Unfortunately, I can't do that. But that total number is the actual cost of medical-related care for obesity patients in the United States of America in the year 2008. Hello, my name is Nicolas Reyes, and I'm going to be talking to you today about obesity in America. Obesity is a very fast-rising epidemic in the United States that has dire consequences on our society as a whole. I have done extensive research work on this topic, and will talk to you about what obesity is and what the impact is on the United States economically. I hope that this speech will give you a better understanding of obesity in America. First, let's take a look at what obesity is and the health effects that it has at the individual level. In order to better understand obesity, we have to define it, know what causes it, and know what effects it can have on an individual. According to Medline Plus, which is a service organization for the United States National Library of Medicine, obesity is basically referred to as somebody who has excess body fat. The body mass index tool, is a tool that calculates body fat. And the way that it does it, it takes a person's weight divided by height in inches squared multiplied by the number 703. A BMI result of 30 or greater indicates excess body fat. Obesity tends to occur when people eat more calories from food than they burn over a period of time. There are many contributing factors to obesity, and some of them include environmental factors, illness, cultural, and social. There are also many health-related risks associated or attributed to obesity. Coronary heart disease, type 2 diabetes, certain cancers, and strokes are just some to name a few. Along with these, there are also negative side effects, negative psychological effects, as well as social. Now we know how obesity affects us at the individual level. Let's take a look at how obesity affects the United States from an economic standpoint. The first is direct medical costs. This basically refers to the cost of medical care for obesity and obesity-related or enhanced diseases. The total cost of this has been projected at between $86 and $147 billion annually. The second is productivity costs, which are more indirect and include but are not limited to things such as less productivity at work due to obesity or someone missing out on work due to obesity-related incidences. The total cost for this is approximately $66 billion annually. The third is transportation costs. Heavier people or obese people in vehicles cause the car to use up more fuel. Same to be said for jet airliners. They have done extensive research, and each airline company calculates to the pound how much fuel it spends. Obese people contribute to that and ends up costing them more money in the long run. And they've actually counted that total around $2.5 billion. The fourth is human capital costs. According to the article, many studies were done to see if obesity had an overall negative impact on individuals' education, and it concluded that it did. According to the article, obese people completed 1/10 to 3/10 grades fewer and were also absent 1.2 to 2.1 days more than people of normal weight. Understanding the impact obesity can have on us and our country, it is not very difficult to see just how important it is for us to try and prevent this epidemic from happening. There are many different ways to help prevent obesity. Some of them include consistently maintaining a healthy diet of foods, 30 minutes or more of cardio or physical activity at least 3 times a week. The Centers for Disease Control and Prevention actually came up with a list of 24 different strategies for communities to help prevent obesity. Some of the recommendations are increased availability of healthier foods and beverage choices in public service venues, discourage consumption of sugar-sweetened beverages, increase the amount of physical activity in physical activity programs, and limit the advertisements of less healthy foods and beverages. In conclusion, although obesity is a fast-growing epidemic, it is one of the few that we can prevent. We have gone over what obesity is and some of its causes and impacts from the individual level all the way up to the national level. We also have gone over just some of the ways that we can prevent obesity from occurring. Although we will never be able to completely eliminate obesity from society, I hope that you now have a better understanding of obesity in America and will use this power and information to help educate your fellow neighbors, brothers, and sisters. Thank you.